Good morning.
Morning, how are you?
Good, good. How about you?
Fine, thank you. It is
Yeah,
8 o'clock now.
I think we misunderstood about the time difference right now because it said that it will start at 2 our local time. So, is it okay for you, Prof. Nihal? For
Not really, because I'm stuck in an airport. I need to go in an hour.
okay. So I will let
If it is
Prof.
possible, we can postpone.
Okay, let me ask Prof. Ika first, then
Mhm.
we can start. Okay, I'm so sorry for the inconvenience.
Sorry about this too. Like I didn't mean to be in this place, but yeah, I just need to do this now.
Yeah, yeah,
Thank you.
yeah. No worries. Yeah, thanks.
Hello, Engin.
Yeah, hi, Ika, how are you? Can you hear me?
Fine, thank you. Yeah. Now the students will enter the room. because we
Okay.
made a mistake with the 5 and 6 hours differences.
Okay.
Yeah, sorry for that.
Okay.
Yeah.
No problem. I mean, the thing is, normally it is not a problem, but like I'm kind of stuck in an airport and I have this room up until 9:30. So
Oh,
like I
okay,
can
okay,
start
okay.
at 9.
Okay.
So
Okay.
okay.
Yeah.
Yeah,
Yeah.
we will wait up until they come. Thank
Yeah.
you.
Sorry to let you wait. Yeah.
No problem.
Yeah.
No
Thank
problem.
you.
Are you okay? Everything is good?
Yes, everything is good. Yeah. We are just submitting a proposal for the e-Asia link. That is the
Okay.
between Australia, Malaysia, Siti Hawa, yeah,
Okay, nice.
and me, yeah, yeah,
Okay, good
yes,
luck. I hope it works.
yes, yeah, fully, yeah. Actually, for the support to go to the Strasbourg through the Science at Impact, I cannot get that one. Yeah, because so
Okay.
many. Yeah, but it's good because as Philip said that what is called the amount is not so high, so
I see.
that
I
will be a
see.
problem. Yeah,
Okay.
yeah.
We can see
Yes.
if there might be another option for that.
Yes, 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 yes. And we look forward for your trial here. Yeah, in Indonesia. Yes.
Yeah.
Yeah. Mhm. Because now the National Agency of um, Innovation, Research and Innovations, they have the support for the translational research also. Yeah.
Okay. Perfect.
Hello. Semua tolong, sorry Engin, I'm using Indonesian.
Yeah, of
Tolong
course.
di mute dulu ya semuanya ya. Is Saika already here? Hello. Yeah.
Do you see my screen, Ika? The
Yes,
presentation is
yes,
okay?
yes, 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 yes. I can see your screen. Yeah. Okay. Before let me using Indonesian. Mahasiswa semua yang saya hormati, selamat siang. Assalamualaikum warahmatullahi wabarakatuh. Ya, ya. Mohon maaf, ini kan karena biasanya itu time difference itu berubah ya, pada musim yang berbeda itu berubah. So we have what is called we have 6 and 5 hours differences depend on the period or the
Yeah.
season, like that. Yes.
I know. I have the same problem in Turkey. It changes like the summer, winter time. Yeah.
Okay.
I didn't notice
Oh,
that. Yeah.
yeah. So that's why for students we are sorry because it is earlier than schedule ya. Bisa di mute ya, ada yang belum di mute ya. Saika, hello.
Ada yang jawab?
Hello. Yeah. Okay. Engin, actually, we have more than 120 students will join this. Maybe they are now still entering the room, but I think, is it fine if we start now, Engin?
Yeah, sure,
Yeah. Okay.
perfect.
Before starting this lecture, I would like to introduce you to students. Hello, everybody. Um, Professor Nihal Engin Vrana is from the University of Strasbourg, France, and he is also the CEO of the Inserm startup company in France, and he got so many awards actually. For example, from the European Society for Biomaterials for his innovation. Later, Professor Engin can also share the experience on that one. So our topic today is infection and inflammation in dentistry. How can innovation resolve the challenges? Engin, these students is mostly undergraduate students, and they are now
Okay,
in the topic of infection, inflammation, and regeneration. So
okay, excellent.
we would like to provide them with the international atmosphere, and also with the what is called with the share experience from you about the innovation that we can develop to resolve the problem in dentistry. So Engin, it is
Great.
time for you to start. Yeah.
Thank you very much. Thank you very much, Ika. Thanks for this invitation, and thank you all for coming already. There is already 85 people. So to start with, thanks for the introduction, Ika. Some additional information. Um, as Ika said, I have been working in European project, and today what I'm going to show you is a new project that is specifically about this subject. So I will talk about it. And one of the main things I do is running large scale projects on the topics, and I will come back to this. And Sparta is a result of one of these projects, which was a EU project called Imogel, this one, which at the end we developed technology, and currently we are applying this in the medical field. So if we come back to the dentistry, so a typical implant basically looks like this, with a hard tissue implant interface, where we need the OCR integration. But there is also the soft tissue and the implant interface. And here, what we would like to have is a strong binding with the gingiva. And this happens through the attachment and extracellular matrix secretion of the human gingival fibroblasts. And this requires a specific kind of surface from titanium. Generally, this kind of attachment happens better on smooth titanium surfaces. So there have been developments to ensure that this attachment is in place, but in many cases, due to the surface properties, due to the quality of the gingiva, generally due to the habits of the patient, this attachment doesn't happen properly. And what this results in is that the bacteria in the mouth environment can penetrate through this opening between the implant, between the implant and
Sorry,
the gingiva.
sorry, sorry. Maybe student, please mute your mic.
Oh, disuruh disuruh keluar, guys.
Hello. Yeah. Please mute.
Okay.
Sorry, Engin. Yeah, please.
No problem. No problem. So, in this case, when this happens, and generally this is not something in the beginning the patient feels, so they don't do anything about it. And this results in the formation of a structure called biofilm, which means that a huge amount of bacteria protected in their own secretions, not only because of the presence of this secretion, which is their own extracellular matrix, but also in these conditions they became more senescent, and because of that they are really hard to kill. So, and this grows and grows, and at one point it becomes painful for the patient, or the implant starts to loosen, so it needs to be removed and replaced. And there are two effects about this. One, as I mentioned, this self-produced ECM, which makes it very hard for many of the antimicrobial agents to penetrate. And also the second part is that these structures are very complex microbial communities, so much so that even very large spectrum antibiotics might not be enough to kill all the components inside. So you have a very difficult infection situation. Even physically, it might be difficult to remove. And the process is that, like, once they come on due to the contamination, they adhere, the structure matures. And the worst is, once you have one of these in your mouth, and generally these patients have multiple implants at the same time, it becomes easier and easier for the other implants to be infected again. Like sometimes you get a patient with only one implant infection. Sometimes the case is even worse. They have infections in multiple implants, which might be even endangering for the whole upper or lower jaw. And in this environment, these bacteria are resistant to antibiotic treatments starting from 10 to 1,000 times. And as they are basic resistance, the more you treat, the more they become resistant. And what is the cost of this? First, implant failure, and most of the time not very how to say, simple failure either, where you started to really have alveolar bone absorption, so that like there is long-term effects on the overall um, mouth structure. Sometimes it might be even impossible to reimplant it, which results in morbidity for the patient, and also a very long time to healing, and sometimes not full healing at all. So, and the symptomatic infection rate is about 10%. But overall, the periimplantitis, the presence of the infection can go up to 40, 50%. So it's a very common problem. And recent work also shows that this has, beyond oral health, have effects on the systemic health. And from cardiovascular disease to some autoimmune diseases, having this infection going on in the mouth is quite problematic. So we need the implants. Also, we need implants which will be harder to infect. So this is the current technical challenge. So what can be done and what is being done for this aim is that you can try to modify this part, which will be in contact with the soft tissue, using different methodologies. One thing you can do is to add components that will enable a better attachment of this soft tissue to the implant surface. What kind of components this can be? You can use the molecules that the cells recognize and adhere to. This can be fibronectin, laminin, or you can, because these are proteins, they have generally tendency to denature, do not keep their original form and lose their activity. So to keep them simpler and more stable, you can also use adhesive peptides. We know certain sequences like laminin mimicking sequences that will act like laminin, maybe not as good, but in a more stable way. So this is one way of handling the problem. The other way is more preventive. So you assume that the penetration will happen anyway, no matter how much adhesion will happen, which is in many cases a right assumption, because it's not just the surface of the implant the problem, it is sometimes the healing capacity of the patient, which is the actual problem. So to be able to do this, there are different ways to modify the surface with antimicrobial compounds this time. So this can be silver ions to kill bacteria. This can be some polymers which are antimicrobial, but in the sense of non-fouling, which means that bacteria cannot adhere to it, so that you don't have this infection problem. But it will be hard for the human cells to adhere to that also. Or you can use some natural compounds with known effects, some essential oils, some complex structures like honey. All these can be used. But in both configurations, you do not have the both effect you are after. You do not have a synergy between this soft tissue adhesion and the antimicrobial properties. So the ideal case would be having a bifunctional coating that will be at the same time helping cells to adhere and differentiate, and so that they secrete the necessary extracellular matrix, so you have a proper sealing of the implant, and at the same time which can kill the bacteria directly without having any negative effect on the cells. So this will be the ideal case for the implants, and this is what we are trying to do in a project called Bioimtitis, where we are trying to develop a bioactive interface so that we can ensure the long-term integration of the implant. And for this, we have two approaches. One is trying to put such coatings on the surface of the implant from the beginning at the production level, so that we have a very highly performing implant. And this is one part we are doing. And the other one is more at the interventional level, so that you can have any kind of implant in the market, and we will provide the devices that will enable the application of this coating to the implant during the implantation, so that you can have this effect on all kind of implants. And for this, we are also developing suitable instrumentation to ensure this activity. And one last part is that another thing with the dental implants is that we use titanium because of its anti-corrosion properties. It is well accepted by the body, and also cells generally have a good enough capacity to adhere to it, especially the osteoblasts when the surface is rough, as it is in the bottom part. But it's still a heavy metal. So that there is a stress shielding effect by implanting the titanium implants. The difference between the mechanical properties of the implants and the surrounding bone is very significant. So another part of the project is trying to come up with low modulus titanium to prevent this effect. I will talk less about this part. I will mainly focus on how these kind of coatings can be done, and I will try to give you more information about what we do as Sparta as a company for developing these kind of coatings. And within this project, we are working with a big dental company called Antroger. This is a French company, which is an affiliate of the world's biggest dental implant company, Straumann, which is a Swiss company. And here, on one side, we are trying to develop these multifunctional coatings that can kill the bacteria and enable the adhesion of the human gingival fibroblast, so that we have very good soft tissue integration and bacterial adhesion prevention. On the other side, we are trying to develop the right spray devices so that this can be applied during the surgery, a handheld spray that is suitable for oral surgery. And this will go into treatment in an animal model. On one side, preventive, which means that normal implants, we do the coating, then we monitor with an intentional infection afterwards, or to see if this has curative properties, which means that we will do the infection first, then remove the implant, treat the implant site and the implant, and reimplant it to see if with the coating and the spraying we can ensure that the revision surgery is successful. This is one of the biggest problems at the moment for these kind of implants. I mean, the first infection, it happens, but once you remove the implant, once you do the revision, you might miss some of the pockets of the bacteria presence, small agglomerates, not necessarily a full biofilm, but agglomerates of bacteria, and it comes back. So the patient finds themselves in this vicious cycle that it doesn't heal, and it is quite uncomfortable also. So if we can have tools to ensure that we can treat this, it will be a big advantage. So to take a step back to explain to you where does this kind of coatings come from, I will try to explain to you what our activity as Sparta. Sparta, as Ika mentioned, is a company that came from INSERM. INSERM is the National Institute of Health in France. And our main focus is infection. Infection in hospitals, particularly related to the medical devices. So infection is one of the most common cases of that. And in the hospital environment, nearly half of the infections are related with medical devices. So we were a group that has been working with medical devices, particularly in otorhinolaryngology, so which is an area where the infection rate is quite high. So we decided to develop structures that will prevent this infection. We are inspired by the natural defenses of the bodies, particularly in Strasbourg. We have 4 Nobel Prizes, and one of them is about defensins in the 80s. One of the first antimicrobial peptides discovered. So basically, we are basing ourselves on that to make the polymer versions of such molecules so that we can apply them. And another Nobel Prize in Strasbourg is with supramolecular chemistry, and we are using this. I mean, our extracellular matrix is a supramolecular structure. With these, what is meant is that you have multiple molecules which are not covalently bound to each other, but they have these dynamic interactions, very strong interactions, which enables them to have these dynamic, very modulus organization. So we are trying to do the same thing as coatings, and we call this biointelligence. With what we mean in biointelligence is that in nature, because of the evolutionary pressures, the organisms develop all these defense systems. Uh, Diverse defense systems against bacteria, against fungi, against viruses. But some of these molecules are found in plants, some of them are in mushrooms, others are in animals. So what we are doing is taking these molecules and do microstructures that can really harness their activity. So this is how we started in 2019. Since then, we have been working with multiple companies, providing this kind of coatings to them as a service. And currently, we are going towards a clinical trial in a facial reconstruction project with these. And while doing this, as we try to apply this to different materials that I will show to you, we realize that if you try to do this empirically, just like experimentally, it takes a lot of time. So we started to improve our capacities in data science, particularly machine learning, so that now we have in-house machine learning models that enable us to develop specific coatings for specific surfaces. So a client can come to us with a specific surface, and we can develop a specific coating for that. So this is what it looks like. So as you can see, this is a system which kills the bacteria by contact, and it has 3 main advantages. As it is a self-assembly process, um, it can be applied to any kind of surface, very complex surfaces such as dental implants. And it can, as it is using biocompatible materials, it can be simultaneously applied to the tissue, such as gingiva, and the implant. This cannot be done with most of the disinfectants, or it can be done, but with negative effects. It is completely biodegradable, and the degradation happens locally, so there is no systemic effects. And because of the self-assembly, you can these are like thin hydrogels, so that you can also add additional components for having additional effects. So how we can develop these specifically is that we have a catalog of biopolymers, multiple molecules that we are using, coming from the experience of the lab that we are coming from. So this is our basis. Then we have in-house AI models that are tailored to ensure that we can get an idea about the specific effect we are searching for. And by using these, we can develop new active interfaces with two or more components, which will be a customized solution for each specific customer. While doing this, we also have the capacity to do necessary microbiology testing. We also use sometimes bacteria source polymers for this kind of testing. And we also develop, as I'm shown before, this is what we are trying to do for the dental part now, to develop necessary coating devices so that this kind of coatings can be applied either at the hospital or at the factory level. And one last thing that we are trying to achieve is that to ensure that what you do is actually working, it is important to have a system which is as close as possible to the actual application area. So we are trying to do real life mimicking testing environments so that we can develop product specific test methods, or sometimes use case specific test methods. And this is something we call Sparta Shield. It is being applied to multiple different medical applications, orthopedic implants, ophthalmologic devices, sometimes, and also dental implants. And I won't touch this much today, but this is also being applied to other areas because this problem is quite widespread. We are doing this also for cosmetics and also for packaging in the sense that, for example, for ophthalmologic eye drops. What I will focus on, and this is the link with the dental part, is that at the moment we have a system that can apply such coatings to wounds and large-scale medical devices, which is called Protectine. So this is effective against multi-resistant gram-positive and gram-negative bacteria. And bacteria cannot develop resistance to it. It is completely water-based and biocompatible and biodegradable. So this can be applied directly to the wounds and also to the implants during the implantation. And in this case, we have efficacy against multiple surfaces. Like for the dental implants, what is important is titanium and ceramic. But for other implants, such as breast implants, we need silicone, polyurethane. For most of the bandages, they are made of polypropylene. And this system is effective against all of them. And here you see one in vivo model. This is a hernia mesh. And when you infect the hernia mesh, this is what it looks like, a lot of pus and biofilm formation. And with the coating, we can keep the surface completely clean with normal healing, even faster healing, because the coating components have known anti-inflammatory properties. So this helps with that. And from the observational part, we also observed that applying these kind of coatings will decrease the pain sensitivity in wounds. I'm curious how this effect will translate to the gingiva and the dental implants. On that, we don't have data yet, but that's something quite interests us. And what we are trying to work on beyond preventive, as in the case of the dental implants, if the biofilm is already there, can we decrease the biofilm volume at least so that it can be debrided. So this is how we apply this to wounds. And it works against a wide range of gram-positive and gram-negative bacteria, including the antibiotic-resistant bacteria, and also some of the fungi. And this is after 24 hours. You can, this is a bioluminescent strain of methicillin-resistant S. aureus, which is one of the most common antibiotic-resistant bacteria. And in 24 hours, you can already see a biofilm formation on the wounds. And these are rats with a very strong immune system, but nevertheless, once it is infected, this is nearly unavoidable. And by spraying these, we can completely prevent it. And no sensitization of the skin, no toxicity. It can be stored in room temperature for 24 months. And as I mentioned, if you have complex systems with multiple materials, such as you can say that dental implants are like that because different parts of it is using different kind of materials, and it works on that. I will show you one example with a German wound care company that we are doing. And in the wound care, you have three configurations of contamination. Either the wound is contaminated, and when you put the bandage, you contaminate bandage too. Or the bandage is contaminated, which comes and contaminates the wound. And the third option is the wound has already been contaminated. Actually, you didn't contaminate the wound by dealing with it. The contamination was already there. It is at biofilm level. So what I have shown in the beginning, the dispersal starts to happen, and the bandage works as a kind of a reservoir for this. And we have done animal tests in all these three configurations with coated bandages, and this is going to be published soon. And again, without coating, you can see a very clear biofilm formation and 7 to 8 log growth of bacteria on the area within 72 hours. And with the coating, it is completely clean. And to show that the point about the bandage becomes a reservoir, when you remove the bandages and quantify the bacteria on it, as you can see, there is a very dense bacterial presence in nearly all bandages. So the other validation we have done with this spray is that we spray this on the wounds to see if there is an inflammation induction. Actually, there is no inflammation induction. And even better is that the compounds we are using, we have shown in vitro that they attenuate the effect of the lipopolysaccharide, which is a component of the bacterial membrane, and generally induce a very strong immune response. So it decreases this. So it kills the bacteria, but at the same time, decrease the reaction of the immune cells around, so it contributes to healing. And also this is done through the effect of the immune cells on the, sorry, here. So we can see that the healing process is nearly over in 20 hours. Here in the normal conditions, after 2 days, it's about to be closed. So you are increasing nearly more than 50% the healing rate. And this has some macro effects too with the incisions. We have observed that when you spray, you started to have much less mechanical sensitivity, much less temperature sensitivity, and also better behavior in the sense of walking, running, clasping to objects. All these improve by at the wound level. As I said, I'm curious about how this will translate to implantable devices, but this might mean that there might be less chronic pain involved with these kind of implants. This is not a big deal in the dental part, but for example, in spine, this happens to about 10 to 15% of patients, persistent chronic pain, which makes life quite difficult. So this is why we are checking this actually. So at the moment, what we are working on this part is to apply this on surgical wounds and develop the specific coating applicators for different kind of implants. And today it's a bit out of scope, but other part of the this infection problem is the hospital environment itself. So we are developing coatings which can be applied to the hospital environment, such as medical fabrics, so that you are diminishing the number of bacteria available, and through that you can diminish this kind of effects. This will not work in the case of dental implants, but for some surgeries this might have additional benefits. Now, in this context, another thing that is being developed at the moment is to have a more of a One Health approach, meaning that not only focusing on the human health, but at the same time focusing on the animal and the environmental health. One part of this is we are using biopolymers that are not accumulating in the nature, so that is for the environmental part. But for the animal part, what we are trying to do is that trying to find configurations where we will have a significant benefit both for human patients but also for animal patients. Because like normally, because these are implants, it is nearly unavoidable to do animal tests. But you do these animal tests with healthy animals, you intentionally create a defect and do these tests. On one side, there are ethical concerns. On the other side, this is not very representative of the actual pathology. It is something that you are creating. So to avoid this and also to contribute to the health of the pets, in this specific case, what we are going to do is that in the facial cancer, which happens to humans, luckily not very frequently, but still it happens quite a lot. We are going to use implants that will replace the removed bone with an antimicrobial coating to prevent the infection. And it turns out that this kind of facial cancer is quite common for the dogs and cats also. So using veterinary hospitals, we will do a veterinary clinical trial to ensure that we test the system in a relevant animal model, but at the same time, it's not healthy animals, so we help with their improvement of their health. So this is an ongoing French national project. We are working with the University Hospital of Toulouse. The idea is after the cancer diagnostic and the initial removal surgery and radiation, the image will be taken, and with a company called Materialize, they will 3D print structures that will replace the defect area. Mostly, this happens mostly in the jaw. It can be cheek, but it is mostly the jawbone. And this will be a hybrid implant of titanium and ceramic to ensure better integration. And as this is in contact with the mouth flora, the infection rate is 60 to 80%. Some doctors say that it gets infected all the time. It's just sometimes they can resolve. So to prevent this, we will use our spray system. And as an additional part, sorry, as an additional part to improve, as you can imagine, these are quite big implants, so you need to ensure that they are vascularized, so there is enough nutrition, so the tissue around it stay healthy. For these, we are going to add albumin membranes, and this will be implanted as a surgical procedure using these 4 different materials. And where we are at the moment is that we are going to test this in rats, and 2 types of rats. One health rat, and the other is the irradiated rats, so that when they have the implant, to understand what is the effect of irradiation on the acceptance and the interaction of the implant with the surrounding tissue. So this is what is going on in the background, and what we are trying to work with a university in Paris called University of Cergy-Pontoise, find the right configuration for having surfaces which are also adhesive for human and gingival fibroblasts. So our first target is using fibronectin. Fibronectin is part of human extracellular matrix. It is available in human plasma, and so it can be purified from human plasma. It is about 440 kilodalton. You can say it is kind of a medium-sized molecule. and it is negatively charged at the physiological pH. And this negative charge can be used to make it interact in a supramolecular manner with positively charged polymers such as polyepsilon lysine. Uh, and when you do this, you started to have these structures, these supramolecular assemblies. And the important thing is to see if this will keep the properties of fibronectin. So experimentally, what we have done is that this is done in an iterative manner. We put it layer by layer, and by using ATR, FTIR, which is a technique based on infrared, where you have specific bands for specific molecules, and these bands, for example, is linked with the proteins, so that as you can see, by increasing the number of layers, you significantly increase the number of band, the size of the band, the absorbance, which means you have much more molecule. And this is for seeing layer by layer. And in the end, to be able to quantify, there are methodologies to quantify proteins. One very common one is BCA, which is cincinonic acid, which directly interacts with the proteins. And as you can see, one of the advantages is that if you put fibronectin on a surface, this is passive absorption. And because of passive absorption, you have a limited amount of material. If you put it together with the PLL, now it increases the amount of protein you can put on the surface. And if you do it in an iterative manner, multiple times, like 10 times, then you start to have an exponential growth. And the more fibronectin you have, a better attachment you will end up with. And this is how we are checking these. First, we look at if there is any toxicity. PLL, like all polycationic positively charged molecules, has a slight toxicity. But when it is in contact with fibronectin, as part of the molecule is interacting with fibronectin, this toxicity disappears. And the way the cells attach to it in the presence of PLL and fibronectin is more or less the same. It increases the cell proliferation. And what you see also is that if you go, like this is a triple marking, you see the cell nucleus in blue, you have the fibronectin in red, the molecule in red, and vinculin is the protein in the cells that interact with the fibronectin. So if you do this in two configurations, you can see that when you have this structure where you have much more fibronectin, you have much strong cell matrix interactions. You can see from this presence of these fibers, the number of focal adhesions. And so you are significantly increasing the interaction with the substrate and the surrounding tissue. So it is moving towards this. And even at this level, we already have some, not fully, but some antimicrobial activity against some of the relevant pathogens in the mouth flora. But not enough. Not enough because it is only anti-adhesive. It doesn't really remove them. So even if, as you can see, there is still a small group. And in the real life, this small group will go back to this level quite fast again. So this is why we are trying to incorporate this structure into what I have shown you for the wounds, which is composed of hyaluronic acid and polyarginine. And this we already know has very strong antimicrobial effect, which is dependent on the size. But at the optimized size, we have a very strong antimicrobial effects against a large scale of bacteria, more than 99.9% inhibition, actually, 3-log inhibition. But this is a very hydrated system, so the cells have trouble attaching to it. And currently the work is to combine these so that we have the fibronectin components in this structure, so that not only we have a very strong antimicrobial effect, but we also have the effect of fibronectin, so that this will be suitable for use in the case of dental implants. So this is what we are working on. As I mentioned, we already have quite advanced industrial level work on some other medical devices, and in some packaging systems. And some of the things we are working on is to have these kind of applications for skin, not necessarily for medical purposes, but more for cosmetic, against itching, scratching, swelling, which is mostly related with fungal and bacterial presence actually. And we also have antiviral versions that can be used for different applications. And we are trying to develop the necessary devices. The device I showed you is designed for wound, but now we are trying to miniaturize it so that it can. Just a second, please. Sorry. We are trying to develop the specific devices, and for the anti-inflammatory part, we have some formulations, but it is generally based on proteins. Here I can show you one example for the silicone implants for trachea, which can be covered with these parts. Here, generally, the material itself is not enough. We need to have cytokines, but like even the material itself will have a significant effect. This is the normal silicone. You can see a very strong immune reaction. Whereas with the presence of the protein coatings, we can have still inflammatory but more normal connective tissue-like structure. If you have the right cytokine cocktails being released, then you can end up with a normal connective tissue. So this is less relevant again for the dental implants, but also control of the inflammation around the implant surface is quite important. Now, I would like to finish with one example of the ongoing projects. As I mentioned, it is quite important for us for doing One Health. And in One Health, there is the environmental aspect. And for the environmental aspect, you need to have toxicology systems. So for this, we are coordinating a project called ToxBox, which is a toxicology platform, and which means that you can test new materials, new developed materials, such as the low modulus titanium I mentioned, by different organs, organ-on-a-chip structures to monitor their presence. But also you can test them against the environmental parts, um, which using zebrafish embryo. And these are being done in microfluidic architectures with integrated electrochemical sensors, integrated ELISA and microscopy, all in one structure. And as we have multiple data sources, we also do the data bridging within the system so that you can look at the effect of your molecule in a very comprehensive, holistic manner so that we can design the next generation medical devices with safe and sustainable by design. And I would like to just show you a short video on this. So this kind of activity opens us the route to go beyond the hospital. And the first aim is to be able to use such systems in the emergencies and the veterinary part. But beyond that, in more consumer-oriented parts where you can have impact on larger scale, mainly consumer products, mainly cosmetic products, and also food packaging. So this is where we are now. We are using the biointelligence to create active interfaces. First aim is to decrease the hospital-acquired infections, especially implant-related infections, including the dental implants. The next aim is to personalize the implants to have coatings, not only antimicrobial, but also have positive effect on the integration. And the long-term ambition is to also incorporate the microbiota so that we can also contribute to homeostasis. So thank you for your attention, and I would be happy to answer if you have any questions.
Yeah. Thank you very much, Prof. Engin, for the lecture for students. When Prof. Engin talks about implants, of course, it is not limited to the dental implants only, but also, for example, earrings, you can have the catheter, you can have the sutures for the surgery, etc. So many kinds of implants that we can use in our daily lives. And when you have the innovation for the implants, or you would like to treat your patients with the implants, of course, you need the implant to have the good adhesion with the cells surrounding the implants. However, when you get the good adhesions with the surrounding cells around the implants, of course, the bacteria will also like the surface of the implants, right? So
Exactly.
the innovations that Professor Engin and team have already developed is how to improve the performance of the implants, but also provide them with the antibacterial or antimicrobial properties for that. So that's the lecture from Prof. Engin, and now it is open for discussions. Okay, please. Who would like to ask question? Silakan untuk bertanya mumpung Prof. Engin ada di sini. Mungkin dari Saika? Hello. Or maybe Dr. Aryan, please. Oh, Maria, silakan. Yeah, Maria, please, you can ask. And next one, Safira Ayodhya. Yeah, Maria, please.
Okay, thank you. Am I audible?
Yes.
Go ahead.
Okay.
Yes.
First of all, thank you so much for the materials. I really appreciate, and I think that this innovation is a very good idea. And my question is, do you think that it is possible to apply this into the developing country? And if it is, can you explain what strategies that could be used to make Sparta medical products more affordable and accessible in developing countries? Thank you.
Thank you very much. I mean, for example, for Indonesia, I'm currently an adjunct professor in your university. So the aim is, if we can, to be able to do the clinical trials of these partially in Indonesia so that it can be available in Indonesia. The pricing issue generally comes from the necessary steps of producing such medical devices. They are expensive because producing them are expensive because they need to be produced in clean rooms. There is also validation that needs to be done. You are losing a lot of material to produce it. And for me, the solution to this is to produce as much as possible locally. If everything can be sourced locally, and it is not like produced in one place and then distributed from there, where you have less control over the initial price. If it can be produced locally, it will be uh, much more affordable. And the second thing we are trying to do is that the reason we would like to do an electromechanical version is that there we can have cartridges, so that what you are going to provide to the hospital, you will provide the device in the beginning and you can give it for free. And then all that needs to be bought is the cartridges, and producing a cartridge is much easier than producing a full medical device. And there's something else that can make it affordable.
Maria, is there any other question for Prof. Engin?
That's all. Thank you so much.
Yeah, thank you for the nice question, Maria. Actually, if you want, you can also do the internship in Sparta, right, Prof. Engin?
Yeah, of course.
Yeah.
Of course.
Yes. You can do the internship there and see what is going on in Sparta. So that you can learn also about some technologies there. Yeah, even with the internship with the non-degree, and Dr. Aryan will assist you on this as well. Yeah.
Perfect.
Okay, thank you very much. And Safiera, please, you can ask now.
Okay, hello, Sir Nigel. So, actually, I've been interested in your mechanical engineering right now, and I noticed about the clinical use cases in the Protect Ion. Sorry if I pronounce it wrong. So, I would like to ask about how will the Protect Ion this approach be objectively compared to current standard wound care or implant coding methods in terms of efficiency and safety?
Yeah. So, thank you. Now, this approach is something in between with what is available. There are products, the medical devices with antimicrobial coatings, particularly in orthopedics, with quaternary ammonium, but they can only afford the antimicrobial parts on the implants. Then you have all these wound cleaning solutions and disinfectants such as Prontozan, which can be applied to the wound. What we are trying to do is to have a system which can do both at the same time. And the other part is that it is not just a cleaning system, it provides a membrane on the surface, so that, like, it's not just that you are preventing the contamination at that moment, uh, it stays there for a while so that the contamination doesn't come later. Because, I mean, the operation is sterile, everything is done properly, but then just after you are finished, any kind of contact, any kind of touch will bring additional contamination. And everything you have done for cleaning is not useful for that. This is where we are trying to be, like, to have this surface that can be active for a given amount of time, not forever, but given amount of time, that can keep the wound and the implant device safe. So that is the main additional effect.
Okay, I understand. Thank you, Sir Nihal.
Yeah.
Thank you.
Thank you, Safiera, for the question. For all the students, I would like also to announce that our ministry has the scholarship. It is called the PMDSU, Program Magister Menuju Doktor untuk mahasiswa unggul, begitu. Nah, with the PMDSU scholarship, we can have the joint supervisions with the expert from international expert, and you can also do some of your project in the expert institutions like that. So if you study well during your undergraduate study, and then you can finish your undergraduate study, then you can enter in the fast track of the master and doctor degree using the PMDSU scholarship, that you can be supervised by Professor Engin or other professor from international institutions like that. Yeah. So this is a good opportunity, I think, and hopefully that one day there are some students who will be supervised by Prof. Engin. Yeah. Okay.
Yeah,
Is there
would
any
love to
other
have that.
question? Yeah. Is there any other question?
Sorry, Prof. Ika. Am I
Yes,
allowed to ask the
Yes,
question
yes.
to
Of
Prof.
course,
Engin?
of course, of course.
Yeah.
Yeah.
Thank you, Prof.
Yes.
Engin, for the interesting topic. So as I understand correctly about your presentation before, so your coating method is about the spraying technique, right? And then how can you make sure that the coating will evenly distributed? Uh, Especially if the structure is not it's not like flat surface.
Yeah.
And for
Yeah.
the second question, because I know you are also the microbiologist, in your opinion, which coating method that work best, especially if we consider about the antibiotic or antimicrobial properties? Thank you.
Thank you very much. So the first question, this is one of the reasons we are trying to use supramolecular assembly, because if you're just trying to coat one molecule with spraying, it won't be homogeneous. You are right, because like you cannot cover all the surface. But if you have two molecules that are interacting, if you can wet the whole surface, which is plausible, then the coating will develop by itself, and that's what makes it homogeneous. So that is one of the biggest advantages of supramolecular chemistry. For this specific case, that is the main advantage. As for the coatings, I mean, from the commercially available ones, the hydroxyapatite coatings for the integration is quite performing, and they have a slight negative effect on the bacterial attachment too, so there is that advantage too, but not fully. The anodization of the titanium is quite effective against bacteria too, but not for the crown part, not the abutment, but the body part of the titanium. So it is not as effective for the abutment. And that's why like more biological solution based solutions for that gingival contact is important. That's why we are working on that. Otherwise, like currently in the dental practice, the success rate is high. Generally, this problem is handled quite well, but the thing is, it is a very high volume medical device. So even if you are having not much of a percentage, the number of affected patients is quite high. So having multiple technologies is good.
Well,
Yeah.
yeah, thank you so much for your explanation.
Okay.
Thank you.
Yeah. And other students would like to ask question. Talia, maybe Talia? Tiffany, Talia, you would like to ask question?
To be honest, I don't really think about the explanation of the presentation, but I just curious about the biotoxicity have or the coating have any effect on the people or what?
Mhm. Yeah, the toxic, like when you have antimicrobials, they are by definition toxic. So, and this is the other reason to use two molecules, because the presence of the second molecule decreases the toxicity of the antimicrobial agent, but at the same time does not diminish significantly its interaction with the bacteria. And what we are playing at here is that the bacteria is much more negatively charged than human cells or animal cells. And so if you can arrange in a way that you have enough charge to kill the bacteria without having a negative effect on human cells, that is what we are going after. Of course, like if you apply a huge concentration, it will become toxic, but that is true for all molecules eventually.
Thank you.
Thank you.
Okay, thank you very much. Because Prof. Engin will soon depart to other city.
Yeah.
So is there any other question? Maybe the last question?
Prof. Ika, my question.
Yes, of course. Dr. Dedi, please.
Yes, thank you, Prof. Ika. Thank you, Prof, for your very nice presentation. I would like to ask your opinion about the duration of the coating surface. As I understand that if the coating surface reside on the tissue, so there is a biodegradation of the surface of the coating. So what is your opinion about the best or the ideal duration of release for antimicrobial? Thank you.
Yeah. In the wound, what we are trying to have is enough effect between the bandage changes, which is between 2 to 3 days. In
Yes.
the dental implant configuration, because there is much less liquid involved, there is much less bacteria also in a way. I think that we can go to 5 days to a week.
Okay, 5
So,
days.
and like we are trying to use this in the case of, for example, root canal therapy in the form of a gel. And when it is a gel, we can put much more peptide so that like we can keep it clean up until the patient comes back for the second part.
Okay, yeah, okay. Thank you, Prof. Engin.
Yeah.
Thank you.
Yeah.
Thank you for your question.
Thank you very much, Dr. Dedi, Prof. Engin. And I think this is a very interesting lecture. You can see, students, that our opportunity to create innovations is very high in not only in a dentistry or dental area, but also for the medical area in general. As we can see also that hospital-acquired infections is getting increased lately, and this is also needs your innovations to resolve the problems or the challenges in dentistry and also in medical science. And one thing that I would like to also underline here, that we can work interdisciplinary. For example, the supramolecular biology and also supramolecular chemistry can work together with the material scientists, with the microbiologists, with the dentistry, etc. So please, we have to keep learning about new technology, and I think we have to thank to Professor Nihal Engin Vrana for sharing the innovations from the Sparta Medicals and also from the University of Strasbourg. Thank you very much, Engin.
Thank you. Thank you very much, Ika. I hope it was useful for the students. Thank you.
Yeah, it's very useful. Yeah, thank you very much. Yeah.
See you.
And have a safe trip, Engin. Yeah.
Thank you. See you.
Okay.
Bye-bye.
Yeah, see you. Bye. Yeah. Yeah. Untuk seluruh mahasiswa, terima kasih banyak ya untuk kuliah yang sudah dilangsungkan ini. Nanti pada akhir topik, kita juga akan punya satu tema yang nanti akan sangat menarik, yaitu jadi bagaimana kita mengidentifikasi sitokin pada kasus periimplantitis dan kemudian itu digunakan untuk pengembangan alat diagnosis, kemudian imobilisasi protein dan sebagainya, seperti itu. Yang ini merupakan teknologi-teknologi yang dapat kita terapkan dan kita kembangkan untuk mengatasi berbagai macam penyakit ya, yang terkait dengan infeksi, inflamasi, dan penyembuhannya yang nanti dapat dikembangkan di masa depan. Dan kalian adalah generasi yang nanti akan memiliki tugas ya, tidak hanya sebagai seorang dokter gigi, tetapi juga perlu menyumbangkan pemikirannya untuk bidang-bidang yang lainnya. Misalnya di kedokteran gigi ini kita juga punya, ternyata inovasi kita juga bisa digunakan untuk kasus-kasus misalnya wound healing untuk di kulit, kemudian juga menumbuhkan kembali rambut dan sebagainya. Yang ini mungkin ketika kalian masuk di Fakultas Kedokteran Gigi tidak membayangkan sampai sejauh itu ya, tetapi ini kenyataan bahwa kita dokter gigi memang memiliki titik interdisiplin yang sangat kuat di sini. Engineering, biology, kemudian medicine sendiri, dan sebagainya. Oleh karena itu, saya berharap kalian semua sebagai mahasiswa dapat mempelajari lebih baik lagi terkait dengan prinsip-prinsip dasar seperti sistem tubuh manusia yang sudah disampaikan oleh dokter-dokter yang lain pada semester sebelumnya, lalu pada topik ini terkait dengan infeksi, inflamasi, dan penyembuhan luka ya, dan penyembuhannya seperti itu. Mungkin dari Dokter Dedi, Dokter Aryan ada pesan tambahan yang akan disampaikan, monggo silakan.
Ampun, Prof, dari saya.
Ya, dari
Jadi-
Dokter Dedi ada, monggo.
Prof, setuju sekali Prof Vika. Ini merupakan satu pendekatan yang sangat integratif ya Prof ya untuk kolaborasi di masa depan, karena seperti yang disampaikan Prof Vika bahwa untuk bisa mengembangkan sebuah keilmuan itu harus benar-benar menggunakan pendekatan yang multidisiplin ya Vika. Jadi terima kasih Prof Vika sudah menyelenggarakan acara ini, sangat menarik. Terima kasih.
Terima kasih Dokter Dedi. Dan juga untuk mahasiswa, perlu saya sampaikan juga bahwa sebenarnya banyak sekali ya pendanaan-pendanaan yang memungkinkan mahasiswa itu untuk magang. Bisa dalam waktu 1 bulan, 3 bulan, bahkan 1 semester begitu ya. Rajin-rajin saja mencari sumber untuk itu, dan kalau seandainya nanti diperlukan kolaborator, misalnya mau tanya ke saya atau ke Dokter Dedi atau ke Dokter Aryan begitu ya, sebaiknya kami kemana ya, bagaimana caranya ke tempat Prof Engin ya, bagaimana caranya ke Prof Natalia dan sebagainya, silakan saja nanti kontak ke para dosen yang mengampu di topik ini maupun topik-topik yang lainnya. Demikian, dan semoga kuliah pada siang hari ini bermanfaat. Mohon izin saya tutup ya, dan Saika sudah difoto tadi ya ketika ada Prof Engin ya.
Sudah, Prof.
Oke, ya. Terima kasih dan selamat siang. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Terima
kasih.
Terima kasih,
Dok.
Terima kasih, Prof.
Aryan, Dokter Dedi, Dokter Aradia, dan dokter-dokter lain yang sudah hadir. Matur nuwun.